we'll go from there. We are talking about concussion in the high school athlete, and specifically sports-related concussions. This talk is directed more toward the athlete, parents, coaches, people who may encounter concussions as they play or coach their sport or have a child involved in a sport. This talk is not designed to be, teach another physician or an athletic trainer or a physical therapist the ins and outs and the fine details of treating a concussion, but it's meant to help make sure that we all understand concussion and make sure we're all on the same page. The staff at TOC asked me to address three main topics in the talk: the diagnosis of concussion, treatment of concussion, and prevention of concussion. So those are our three main segments of the talk. We'll go through those individually, and then at the conclusion of the presentation, we'll have some time for questions, and we may be able to answer more specific topics at that point. So we'll talk about the diagnosis of concussion first, and then treatment and prevention later. Within this segment of the talk, diagnosis of concussion, we're going to talk about the definition and characteristics of the concussion. You certainly need to know what you're trying to diagnose. We're going to talk about the signs and symptoms of concussion, as well as some red flag signs and symptoms or warning signs that one may encounter. And this would be actually an indication of additional injury in addition to concussion that might need further treatment. So first, I've got this slide that is what we use, and it is the medical definition of concussion. This comes from the consensus group on concussion in sport. It is published in the consensus statement on concussion in sport. It's now in its 5th edition. It was most recently updated in 2016. It's actually due to be updated again in 2020, but we'll see if that group is actually able to meet and produce the update amid the pandemic. But the diagnosis, we'll just read through this. A sports-related concussion is a traumatic brain injury induced by biomechanical forces. It's caused by a direct blow to the head or a blow elsewhere on the body with forces transmitted to the head. Everyone thinks you have to get hit in the head to get a concussion, but you actually don't. There's typically a rapid onset of neurological impairment that resolves. Sometimes, though, the symptoms can develop over a few minutes to a few hours. The concussion is a functional disturbance rather than a structural injury. And there is a range of symptoms, not just one or two or a specific set of symptoms, but there are a range of symptoms that may or may not involve loss of consciousness that typically follow a sequential course of resolving. Sometimes those symptoms may be prolonged. And the signs and symptoms are not explained by another medical condition. So in order to diagnose concussion, the person can't have something else that better explains their symptoms. So what does that all actually mean? That's the medical definition that physicians, physical therapists, athletic trainers, and so forth use to strictly define the concussion. But what does it truly mean in in everyday life? And I tell folks that a concussion is an injury to the brain in which the brain has been stunned. I do emphasize that it is a brain injury. This is something to be taken very seriously. There are forces that are applied to the head, and because of those forces, some chemical changes take place within the brain cell. And because of those chemical changes, the cell is then starving for energy. It's trying to heal itself, it's trying to correct those chemical changes, and it's trying to carry out its normal function. But it doesn't have enough energy to do that. And so dysfunction of the brain cell results. And as we said previously, the concussion is not a structural injury. It is a functional injury. By definition, there is no bleeding, bruising, or swelling of the brain in a concussion. And for that reason, CT scans and MRI scans are not needed if all one suspects is a concussion. Those tests are needed if we see some of these red flags that we talk about in a few moments in order to evaluate for bleeding, bruising, or swelling of the brain. As a result, because these scans, radiologic tests, as well as blood tests and other tests that we have available to us in medicine are not capable of diagnosing concussion. The concussion is actually diagnosed utilizing the history, what we can find out about the injury and the symptoms the patient's having, the physical examination, and different assessment tools, such as the SCAT-5. SCAT stands for Sport Concussion Assessment Tool. There's also a child SCAT-5 for athletes aged 5 to 12, but what we use in the high school athlete would be the SCAT-5. And the 5 just stands for, it's in its 5th edition. Computer-based neurocognitive tests can also be additional tools that we use to diagnose and help monitor the concussion. Impact is a particular brand of neurocognitive test that is computer-based. Basically, what these neurocognitive tests do are they are able to assess cognitive function, memory, retention, patterns, things of that sort. They also measure reaction time, and they can be a helpful tool. The symptoms of concussion, as we said before, are typically on a range of symptoms. And general or common signs and symptoms include headache, nausea, sometimes vomiting, confusion, or sometimes it's described as feeling in a fog, slowed cognition, slowed ability to think and process through things, difficulty concentrating, emotional symptoms and being irritable are fairly common. And this is more than just the typical high school athlete who is just irritable for no good reason, because we all know teenagers can be irritable, but I guess we all can. Loss of consciousness can be a symptom, but as we said before, it is not required for diagnosis of concussion. Some people have previously thought in the past that you can't have a concussion unless you were knocked out, and that is not true. You do not have to have loss of consciousness to have a concussion. As a matter of fact, most concussions that I see do not involve loss of consciousness. Amnesia or memory loss can be present. That can actually be what we call retrograde or anterograde. The athlete can forget or have loss of memory of things that happened before the concussion or things that happened after the concussion. Slowed reaction time is a common sign. Drowsiness is pretty common, and insomnia are all, or really any sleep disturbance are fairly common signs and symptoms. The average duration of symptoms in a high school athlete with sports-related concussion is 2 to 4 weeks. A lot of folks think that once you have a concussion, you're going to feel bad for a day or two, and then you're better, and you're going to go back to play in a day or two. And that typically doesn't happen. It can, but it typically does not. And one thing that clouds people's perception is what we see on TV. A lot of professional athletes or even collegiate athletes may be diagnosed with a concussion. It makes the news, and then they're playing the next week. And so people think, well, my 14-year-old who got their concussion should do the same. It's not, that typically doesn't happen though, because the pediatric brain is different than the adult brain. And typically younger people, the younger the athlete they are, typically the longer they take to recover. And so, like I said, average duration of symptoms is 2 to 4 weeks in the high school athlete. Some red flag signs and symptoms to monitor for with concussion. Any worsening symptoms are concerning. Typically, an athlete will have symptoms at the time of injury. They may get a little bit worse over the first hour or two, but then they should plateau and should gradually improve over the course of 2 to 4 weeks. So worsening symptoms are a concerning finding and would warrant further investigation to look for other injury. If the patient becomes unable to be aroused, they're somnolent would be a word to describe that, or significantly lethargic. That's concerning. Repeated vomiting is a concern. Now, we said previously that vomiting may be a common sign, but if the patient continues to vomit several times, that's concerning. Double vision is a concerning symptom. Blurred vision is fairly common and not too concerning. But if the patient truly sees two of things, that can indicate further pathology, further brain injury. Slurred speech, weakness, or numbness, those are kind of things that always make us think stroke in perhaps older patients. But if a patient has had a concussion and we start seeing these symptoms and signs, then we get concerned for bleeding, bruising, swelling of the brain. And seizure activity is concerning. An initial convulsive activity at the time of injury doesn't necessarily indicate bleeding, bruising, or swelling. That can happen with a concussion, but it certainly warrants further investigation and CT scan, MRI, that sort of thing. So let's talk about treatment of concussion. We've figured out how to diagnose the concussion, what to be looking for. How do we treat the concussion? And there are three pillars or three parts of treating concussion. That's physical, mental, and supportive care. First of all, why do we even care about the concussion, and why do we treat the concussion? Certainly they're common. Concussions occur in every sport, at every position on the team, in male and female athletes, and in practicing game settings. I've been taking care of athletes with concussion for several years, and I can't think of a sport in which I have not seen an athlete with a concussion. Now, there are certainly more sports that are more common. The collision sports like football and rugby and wrestling we see more concussions. Female soccer players seem to be at a higher risk because we're seeing more incidents of concussion in those folks. But again, everyone is at risk. If you play a sport, you can have a concussion. The only way not to get a concussion is to sit on your couch all day, but don't do that because that's not healthy either. So, again, why do we treat the concussion? We want to prevent the symptoms from worsening or lasting even longer. If an athlete tries to go back to play too soon, at the very least, we can worsen their symptoms and make them last even longer. We want to prevent the development of chronic neurologic problems like post-concussion syndromes or even migraine headaches. And the most important thing we're trying to prevent is second impact syndrome. And second impact syndrome is a condition in which someone with a concussion goes back to play, a second impact occurs, and through some additional chemical changes in the brain, an inflammatory cascade is initiated and the brain does start to swell, which again transforms that functional injury into a structural injury, and it's catastrophic. Second impact syndrome results in paralysis or death. Clearly, that's not the outcome we want to have. So that's why I put the picture there on the screen. Thankfully, this is a drill. This athlete is not truly undergoing intubation, but that's one thing that could happen if second impact syndrome occurs. And again, just to remind everyone that these things are serious. And thankfully, we don't see second impact syndrome very often, but it's very serious. A patient of mine who was diagnosed with traumatic brain injury from a motor vehicle crash was telling me, reminded me how life-altering brain injuries can be. And again, thankfully, sports-related concussions don't often progress to that point. But we all have to be concerned because of these things like second impact syndrome and the potential for people who have multiple concussions to have neurologic problems later in life when they're still young, even 40 or 50 years old. Who's involved in the care of a concussion? Several folks. Of course, I as the physician, I'm talking to you tonight, but there's a team of folks who take care of the athlete with concussion, and that involves everyone, including the athletic trainer, physical therapist, family members of the athlete with concussion, coaches, and school personnel, including teachers, guidance counselors, principals. And again, we're all trying to work together to help this athlete with concussion. So again, where do those three pillars of care come in? Physical care, mental care, and supportive care. So the physical care, the idea here is to avoid strenuous activity that would make the symptoms worse and avoid any additional blow to the head or blow to the body with forces transmitted to the head. First thing we do is tell folks, we're not going to participate in athletics right now. We're going to take a break from the sport. We want to avoid any activity that would increase heart rate or create a strain, because that's going to be extra taxing on the brain while it's trying to heal. After the initial 48, at least the initial 48 hours, sometimes a little bit longer, beginning light physical activities such as walking, stretching, and basic yoga can be helpful. And physical therapy has really been shown to be beneficial in treating concussions. Sometimes some eye therapy or helping people to work on their gaze and so forth, because this works on the ocular centers, the balance centers in the brain. That can be very helpful. Formal balance therapy, again, working on what we call the vestibular centers in the brain, can be helpful. And again, these are more symptom directed. If the patient is having blurred vision or difficulty balancing, or they just have vertigo, they feel dizzy, those things are those eye therapies and balance therapies are targeted toward that. A more general therapy technique is this Buffalo concussion treadmill test and protocol. That involves some exercise for the athlete in order to help all of their symptoms improve. The basics of it are they exercise an athlete and determine at what heart rate their symptoms get worse, and then they use a protocol to exercise that athlete below that symptom threshold. And in the high school athlete, that's actually been shown to reduce duration of symptoms by 3 to 4 days. And if you think back to the average duration of symptoms being 2 to 4 weeks, shortening that by 3 to 4 days can be pretty significant. And the picture here just is showing a physical therapist working with a patient on some again, ocular or eye therapy. He's having them shift their gaze from one finger to the other. Again, trying to help retrain some of those ocular and vestibular balance centers in the brain. The next pillar of care is mental care. We want to rest and reduce any extra brain stimulation. We often will use some school modifications and draft a customized return to learn plan. This can range from anything from keeping the student athlete out of school for a few days if their symptoms are bothersome enough, to upon their return to school, asking the school to help them reduce their workload, allow them to take breaks, reduce the amount of computer-based work that they are doing, because the screen often will exacerbate symptoms, those sorts of things. We ask them to work in short increments with frequent breaks, whether it be at school or at home doing homework, work for 10 or 15 minutes, take a 10 or 15-minute break, then come back to it later. We want to eliminate or reduce screen time. As I mentioned, screen time can be detrimental and cause symptoms to worsen. And that includes everything from TV to video games to computer work to phones. Our smartphones are integral part of our lives these days, and we ask that the student athlete either eliminate or significantly reduce the amount of time they're spending on their phone. We want to eliminate or reduce social activities. We don't want the athlete going to parties or sleepovers where they're staying up all night, things of that sort. We ask that the athlete not drive for a couple of reasons. One, it's dangerous to them, but it could be dangerous to others if they were to cause a crash, and could actually have some legal implications, because they could be cited as an impaired driver if they were to be involved in a crash. And physical therapy comes in here as well, because often the physical therapist will incorporate some cognitive exercises along with the physical therapy. And you see a picture there. The physical therapist is directing the patient to perform some mental activities. I think what they're doing is they're asking them to count certain types of objects they see in that maze of pictures while they do physical activity. It could be something as simple as marching in place. They may be asking them to balance on one leg while they do this. And again, that helps to kind of rewire the brain to be able to do physical and mental tasks at the same time. And supportive care is important. Here we're trying to provide the body with tools to heal. And plenty of sleep is important. We ask that the patient get plenty of sleep each night. They can take a prescribed nap in the afternoon if necessary. We want them to eat a very healthy diet, including some healthy carbs. Fruits are a good source of healthy carbohydrates. And the reason we do this is that the brain's fuel is glucose. Brain cells run on glucose. And so those carbohydrates, some of it will get converted to glucose in the body and will help fuel that starving brain cell that we were talking about in the brain of the concussion. We want the athlete to hydrate well with water and sports drinks. I tell folks that coffee, tea, and those sorts of things, soda pop, those don't count. They need to hydrate with water and sports drinks. They can take over-the-counter medications as needed. That can range from Tylenol to ibuprofen. We do avoid ibuprofen and Aleve in the first 24 hours of the injury, just in case there is a brain bleed, because that could technically worsen the brain bleed. But otherwise, then they can take those medicines as needed for symptoms. I typically recommend a DHA supplement. DHA is a fatty acid that is in fish oil. And we dose, any brand of fish oil is okay, but then I recommend a specific dose to the athlete to take for about a month. And then occasionally we will prescribe medication for treatment of concussion. This can range from anything from some corticosteroids to help with headache, to some medicines, some more neurologically based medicines to treat the headaches or to help with sleep and those sorts of things. Sometimes we need medicines for the mood disturbances. We mentioned that patients can become very emotional or irritable, and sometimes we have to prescribe some medications to help with mood symptoms. And then we start talking about the return to learn and return to sport. And what I've developed here is a little flow chart to kind of outline what happens from the time the athlete has the concussion to the time that they are returning to their sport. So the patient is injured and is symptomatic of the concussion, and then we treat the concussion, and that involves the three segments we just talked about: the physical care, the mental care, and the supportive care. And what we want to see is the patient to become free of symptoms at rest first. They may still have some symptoms when they get up and move around and walk around, or when they're reading or studying, but we want them to be free of symptoms at rest. And then we want them to be able to be involved in full academic activity without symptoms. We want them to be able to read, to study, to be able to look at a computer, to be able to attend class, take notes, take tests, and do everything they need to academically. And then, if they're able to do that without any symptoms, they're having no symptoms with any physical activity, like I said, the light walking, the physical therapy exercises, then we progress on to what we call the return to play protocol. And it's a 6-step process in which we gradually return the patient to their sport with, again, gradually increasing levels of physical activity. Important to the return to play protocol, the athlete cannot be taking any medication during that time, because we don't want to simply mask symptoms. We're looking to see if symptoms come back during this return to play protocol, and we can't simply cover that up with some medication. The return to play protocol is under the direction of an athletic trainer or physical therapist. This is not just let the athlete go out and say, well, I'm going to run a little bit today and I'm going to lift some weights tomorrow. This is a very prescribed set of guidelines and needs to be under the direction of a medical professional. And the athlete only advances from one step to the next if their symptoms do not return. And then again, if they're able to go through the entire protocol without return of symptoms, they're allowed to return to their sport. How do we prevent concussions? This can be difficult. But talk briefly about some devices and techniques here. I warn folks that no device prevents all concussions. People come in often ask, do I need to buy this specific helmet or that specific helmet? And my answer is no. There has been no study to show that any helmet is going to prevent all concussions. People ask about mouth guards. People ask about these skull caps that either go over the helmet or that soccer players may wear, instead of a helmet. And again, none of these are bad things per se, but if you read the marketing, they claim to prevent concussions. And again, no study, no true medical study has shown that any one device will prevent all concussions. So what should you do? You should wear an approved, well-fitting helmet if that's what's involved in your sport. A mouth guard, if applicable to your sport, can be helpful. And then otherwise, it's just some basic stuff. You want to develop good range of motion and strength of the neck. You want to be able to control your head, basically. Follow the rules of the sport. You know, in soccer, you're not supposed to tackle someone, so don't. In football, you're not supposed to spear someone with your head, so don't do those things. And play with a heads up technique, or in other words, don't do what these two guys in the picture are doing. Don't lower your head and lead with your head to spear or hit someone else in the head or whatnot. What are some resources for concussion management? The CDC has actually an excellent set of resources for medical professionals, for athletes, for parents, for coaches, for school personnel. It's all broken down by you know, different segments of that source. So if you have questions about concussion, I would encourage you to go to the CDC Heads Up website, and it can be very helpful. And of course, your primary care, your happy local primary care sports medicine physician, such as myself, we're happy to assist in any way. Athletic trainers at our schools are tremendous resources, and our physical therapists in the clinic, and even sometimes you'll find them on some sidelines helping out, are great resources as well. And that pretty much concludes the formality of the presentation. We will entertain some questions and some discussion here. I'm going to invite Sloan back in, and oh, hold on, I did the wrong thing.
Oh, that's good.
All right.
Thank you so much.